Hello, everyone. Welcome to today's session. I'm excited to share with you some essential techniques on basic life saving. This is our first aid training, and I promise it will be both informative and practical. Over the course of this presentation, we'll cover key first aid skills, how to respond in emergencies, and how to confidently assist others in need. Let's get started and learn how to make a real difference in critical moments. First aid is the immediate care that we provide to someone who is injured or becomes ill, and this happens before professional medical help arrives on the scene. The main goal here is to preserve life, which is the most critical aspect. We also want to prevent the condition from worsening. That's why quick, effective action is so important. And finally, we aim to promote recovery, helping the person get better as smoothly and quickly as possible. As we go through this presentation, keep in mind that first aid is about taking calm, confident steps to make a difference in someone's emergency situation. Now, let's talk about the different types of first aid and when to use each one. First, we have general first aid, which is for minor injuries like small cuts, wounds, sprains, or burns. These are things you can usually handle on your own or with minimal help, but it's still important to know the basics to prevent infection or further injury. Next, we have emergency first aid, which is needed for more serious situations such as cardiac arrest, heavy bleeding, fractures, or snake bites. In these cases, time is critical, and your goal is to stabilize the person and keep them safe until professional help arrives. Remember, acting quickly and confidently can make a huge difference. Finally, there's disaster first aid, which comes into play during large-scale emergencies like earthquakes, floods, or accidents involving many people. The scale and chaos of these events require different approaches, often prioritizing the most urgent cases and working within limited resources. Understanding these different types helps us respond appropriately depending on the situation, ensuring we provide the right level of care while waiting for professional help. This is a key part of being prepared and confident in any emergency. Now, let's talk about the three main objectives of first aid, also known as the 3 Ps. First, preserve life. This is the most important goal, to save the life of someone who's injured or ill. Everything we do in first aid is centered around giving that person the best chance to survive. Next, prevent the condition from getting worse. This means taking immediate actions to stop the situation from becoming more serious. For example, controlling bleeding or preventing further injury. It's about stabilizing the person and preventing complications until professional help arrives. And finally, promote recovery. Once we've preserved life and stopped the condition from worsening, our goal shifts to helping the person recover faster. This can involve simple measures to reduce discomfort or ensure they are as comfortable as possible, ultimately reducing the time they need medical treatment. These 3 objectives guide everything we do in first aid. They help us focus on what's most important to help someone in an emergency. Today, we're going to talk about some common emergency situations where first aid is essential. First up, unconsciousness and fainting. These can happen suddenly, and knowing how to respond quickly can make all the difference. Next, we have burns, including those caused by fire or chemicals. These require prompt care to prevent further injury. Electric shocks are another hazard. They can be serious, so it's important to handle the situation carefully without putting yourself at risk. Wounds and cuts are very common, and knowing how to stop bleeding and clean the wound is vital. Fractures and cracks, these are broken bones, need immobilization to prevent further damage. Dog bites can lead to infections, so swift cleaning and medical attention are necessary. Snake bites are also dangerous, and quick, appropriate action can reduce venom absorption. Drowning is a critical emergency where rescue and resuscitation are life-saving. Choking, whether on food or objects, requires immediate intervention to clear the airway. All these situations highlight the importance of triage, prioritizing who needs help first based on severity. Remember, first aid isn't just about knowing what to do. It's about acting confidently and calmly in these moments to stabilize the injured until professional help arrives. When we encounter an unconscious person, our response is critical. Unconsciousness can result from a variety of causes, such as injury, medical conditions, or lack of oxygen. The first step is to ensure the scene is safe for both the victim and ourselves. Once safety is confirmed, we need to check the person's responsiveness. Gently tap their shoulder and ask loudly, "Are you okay?" If there's no response, it's a sign that immediate action is required. Next, we assess their breathing. Look for chest movement, listen for breath sounds, and feel for air on your cheek. If the person is not breathing normally, we must start CPR right away. Remember, recognizing unconsciousness quickly and acting decisively can make a huge difference in the outcome. This slide highlights the importance of understanding and identifying unconsciousness, which ties into our overall theme of emergency response and the critical steps needed to provide effective aid. Recognizing unconsciousness isn't just about observing, it's about knowing what to do next to assist the person and potentially save their life. Now, let's talk about some common causes of unconsciousness. One major cause is a head injury, which can include brain injuries or concussions. These happen when the brain is shaken or impacted, and they can seriously affect consciousness. Severe bleeding is another critical factor. When there's a lot of blood loss, the brain doesn't get enough oxygen, leading to unconsciousness. Cardiac arrest is also a key cause. This is when the heart stops beating altogether, cutting off blood flow to the brain. Similarly, if breathing stops due to airway blockage, drowning, or choking, the brain is deprived of oxygen, which can quickly lead to unconsciousness. Serious illnesses like epileptic seizures, diabetic comas, or poisoning are also common triggers. These conditions disrupt normal brain function. Toxic substances or drug overdoses can have a similar effect, overwhelming the body's systems. Additionally, a lack of oxygen, known as suffocation or gas inhalation, can cause unconsciousness because the brain isn't getting the oxygen it needs to function properly. Understanding these causes is crucial because recognizing them quickly can make a huge difference in providing timely help and potentially saving lives. They all share the common theme of depriving the brain of essential oxygen or disrupting its normal functioning, which underscores the importance of immediate response in emergency situations. Let's take a closer look at some common causes of fainting. One of the main reasons is a sudden drop in blood pressure, which can happen unexpectedly and reduce blood flow to the brain. This often occurs when someone stands up too quickly or experiences significant emotional stress. Fear and pain are also powerful triggers because they can cause the body to react in ways that lower blood pressure or affect circulation. Environmental factors play a role too. Standing in hot weather or crowded places for a long time can lead to fainting because of overheating or dehydration. Not eating for a long time, which causes low blood sugar, can also make you faint, as your brain needs a steady supply of energy to function properly. Extreme pain or fatigue can weaken the body's response, leading to a fainting episode as well. Lastly, dehydration is a major factor. When the body lacks water, blood volume decreases, making it harder for the heart to pump blood effectively. All of these factors are interconnected and highlight how important it is to maintain good hydration, nutrition, and manage stress to prevent fainting episodes. This understanding helps us see how various triggers can impact overall health and safety. Let's go through the essential steps for helping an unconscious person. First, it's crucial to keep the airway open. This means gently tilting the head back and lifting the chin to make sure nothing is blocking the airway. Next, check the breathing. Look, listen, and feel for breath. If the person isn't breathing normally, we need to act quickly. Then, assess the blood circulation by checking for a pulse, typically at the carotid artery in the neck. If there's no breathing or pulse, it's time to start CPR immediately. While doing this, remember to call emergency services as soon as possible so professional help can arrive. If the person starts breathing again but remains unconscious, turn them into the recovery position. This helps keep the airway clear and prevents choking. Overall, these steps are vital to provide immediate life-saving assistance and ensure the person's safety until professional help arrives. Let's talk about CPR, or cardiopulmonary resuscitation. This is a critical life-saving technique used when someone's heart has stopped beating or they're not breathing. The main goal of CPR is to maintain blood flow and oxygen to the brain and vital organs until professional help arrives. It's a simple but powerful skill that can make the difference between life and death in emergency situations. When performing CPR, it's important to remember the key steps, providing chest compressions and rescue breaths. Compressions help pump blood through the body, while rescue breaths supply oxygen. Proper technique is crucial, compressing the chest at the right depth and speed, about 2 inches deep at a rate of 100 to 120 compressions per minute. Connecting this to the overall theme of emergency preparedness, CPR is an essential tool everyone should know. It empowers bystanders to act confidently, potentially saving lives before emergency services can take over. Remember, quick action and proper technique are vital in these situations. Now, the first step is to check the response and call emergency services immediately. If the person is unresponsive, gently tap their shoulder and shout to see if they react. If there's no response, it's crucial to call for help right away. Next, tilt the person's head back slightly and lift their chin to open the airway. This helps ensure that any obstructions are cleared and allows for proper breathing assessment. Then check if they are breathing normally, look for chest movements, listen for breath sounds, and feel for air on your cheek. If they're not breathing or only gasping, it's time to start CPR. Begin with 30 chest compressions, performed quickly and firmly, about 18 seconds worth, to simulate the heart's pumping action. After these 30 compressions, give one artificial breath by pinching the nose shut, sealing your mouth over theirs, and blowing until their chest rises. This cycle of 30 compressions followed by one breath should be repeated continuously until professional help arrives or the person shows signs of recovery. Remember, the goal is to keep blood circulating and oxygen flowing until emergency responders take over. Consistency and quick action are key in this life-saving process. Electric shock can be a serious hazard in many workplaces. It occurs when electrical energy passes through the body, which can happen if a person touches a live wire or faulty equipment. The key point to remember is that even a small shock can be dangerous, especially if it causes the person to fall or lose control. Most importantly, electric shock can result in burns, nerve damage, or even cardiac arrest in severe cases. That's why it's crucial to follow safety protocols, like turning off power sources before working on electrical systems and using proper protective equipment. Connecting this to our overall theme, understanding electrical hazards and how to prevent shocks is vital for maintaining a safe work environment. It's about being proactive and cautious so we can protect ourselves and our colleagues from potential harm. Let's talk about what you should do to ensure your own safety in an emergency involving electric shock. First, it's crucial to turn off the power supply immediately to prevent further harm. Once that's done, check if the person is breathing and has a pulse. If they are not, call emergency services right away because professional help is essential. Next, assess their injuries. If there are burns or other injuries, treat them carefully. Remember, keep the person still and warm to prevent shock from worsening. Throughout this process, stay with them and monitor their condition until professional help arrives. All of these steps are about acting quickly and safely to stabilize the situation. This is a key part of first aid, making sure you protect both yourself and the injured person while waiting for expert assistance. Today, I want to talk about 2 common types of injuries you might encounter: fire burns and chemical burns. Both of these can be serious, but they have different causes and require different responses. When we say fire burn, we're referring to injuries caused by heat, flames, or hot surfaces. These burns can vary from minor to severe, damaging skin and underlying tissues. On the other hand, chemical burns happen when a caustic substance comes into contact with the skin or eyes, causing a chemical reaction that damages tissues. Recognizing the type of burn is crucial because it influences how we treat the injury and prevent further damage. Understanding these differences is key to responding effectively and keeping ourselves and others safe in emergencies. When dealing with a burn, the first step is to cool it down with running water for about 10 to 15 minutes. This helps to reduce the heat and prevent the burn from getting worse. Remember, do not apply ice, as it can cause further damage to the skin. If the burn is minor, you can apply a burn ointment to soothe the area. After that, cover the burn with a clean cloth to protect it from dirt and infection. It's very important to avoid bursting any blisters that may form, because they serve as a natural barrier against infection. However, if the burn is severe, do not hesitate to seek medical help immediately. Proper first aid can make a big difference in healing and preventing complications, so always act quickly and appropriately. Wounds and cuts are some of the most common injuries we encounter. They can happen in many situations, whether from accidents, falls, or even everyday activities. It's important to understand how to identify different types of wounds, as well as the best ways to treat them. For example, a cut might be shallow or deep, and each requires a different approach. Shallow cuts might just need cleaning and a bandage, while deeper wounds could need more extensive care or even stitches. A key point to remember is that proper wound care helps prevent infection and promotes faster healing. Cleaning the wound thoroughly, removing debris, and applying the right dressing are essential steps. Connecting this to our overall theme, managing wounds effectively is a critical part of first aid. It can make a big difference in recovery time and in preventing complications. So, always assess the severity carefully and respond appropriately to ensure the best outcome. Let's go through the key steps for providing first aid for wounds and cuts. First, it's very important to wash your hands before touching the wound. This helps prevent infection and keeps everything as clean as possible. Next, gently wash the wound with clean water to remove dirt and debris. This step is crucial to reduce the risk of infection and promote healing. After cleaning, if there's bleeding, apply gentle pressure to stop it. Use a clean cloth or sterile gauze and press calmly but firmly until the bleeding slows down or stops. Once the bleeding is under control, apply an antiseptic liquid or ointment. This helps prevent germs from causing an infection. Then cover the wound with a bandage. This protects it from dirt and further injury and helps keep it clean and dry. Remember, keeping the wound clean and dry is essential for proper healing. By following these steps, you can effectively manage minor wounds and cuts, helping them heal quickly and reducing the risk of complications. When we talk about a crack or fracture, we're referring to a break or a split in a material or structure. These can occur for a variety of reasons, such as stress, load, or even material flaws. It's important to understand that cracks can start small, but have the potential to grow if not addressed. Fractures, on the other hand, usually imply a complete break, meaning the material has separated into two or more parts. Recognizing these signs early is crucial for maintaining safety and integrity. Throughout this presentation, we'll see how cracks and fractures play a significant role in material failure and how proper detection can prevent accidents and structural failures. So, understanding what a crack or fracture looks like helps us better analyze and improve the durability of the materials we rely on daily. When someone has a crack or fracture, the first step is crucial. Do not move the injured part. Moving it could cause further damage or pain. Instead, support the area gently but securely. You can do this using a wooden splint and some cloth to keep the limbs stable. If there's swelling, applying an ice pack can help reduce it and minimize pain. Just make sure not to put ice directly on the skin. Wrap it in a cloth first. It's also very important not to try to set the bone yourself. That should only be done by medical professionals. Your main goal is to get the person to a hospital as quickly and safely as possible. These steps are vital because they help prevent additional injury and ensure the person receives proper treatment. Remember, quick and careful action can make a big difference in recovery. Let's take a closer look at dog bites. Dog bites are a common concern when it comes to animal-related injuries. They can happen for a variety of reasons, such as fear, territorial behavior, or provocation. It's important to understand that not all dogs are aggressive, but certain factors can increase the risk of a bite. When a dog bites, the severity can range from a minor nip to a serious injury that requires medical attention. Recognizing the warning signs of an agitated or aggressive dog, like growling or stiff body language, can help prevent bites before they happen. This ties into our overall theme of safety and prevention. Educating ourselves about canine behavior and respecting a dog's space are crucial steps in reducing the risk of bites. Remember, understanding and caution can go a long way in keeping both people and animals safe. Let's go through the key steps for first aid after a dog bite. First, it's important to wash the wound thoroughly with soap and water. This helps remove any dirt or bacteria that could cause infection. Next, apply an antiseptic to the area to further reduce the risk of infection. It's crucial not to cover the wound too tightly, as this can trap bacteria and hinder healing. After taking these initial steps, you should go to the hospital as soon as possible. Medical professionals can assess the bite properly and provide the necessary treatment. This includes taking the anti-rabies vaccine and rabies immunoglobulin, also known as ARV and RIG. These are vital to prevent rabies, which is almost always fatal once symptoms appear. Remember, prompt action is key in managing dog bites effectively and keeping yourself safe. Let's talk about snake bites. When it comes to snake bites, the key points to remember are the types of snakes involved, the symptoms that can develop, and the proper first aid and medical treatment. Recognizing a snake bite quickly is crucial because some snakes are venomous, and their bites can be dangerous or even life-threatening. The most important concept here is prevention, being aware of your surroundings and avoiding snakes when possible. If bitten, staying calm is vital because increased heart rate can spread the venom faster. Immobilize the bitten limb and keep it lower than the heart level if possible. Do not try to suck out the venom or cut the wound. That can do more harm than good. Seek medical help immediately, as antivenom may be necessary depending on the snake and the severity of the bite. Connecting this to our overall theme, understanding snake bites highlights the importance of safety awareness and quick response in outdoor environments. Being prepared and knowledgeable can make a critical difference in such situations. Let's take a closer look at the symptoms of a snake bite. You might notice 2 small fang marks at the bite site, which are the initial signs of a snake bite. Along with that, there could be pain, swelling, and redness around the area. These are common responses as your body reacts to the venom. Some people also experience a burning sensation or numbness near the bite, which can be quite uncomfortable. As the venom spreads, you might start to feel sweating or chills, and even dizziness or weakness. Nausea and vomiting are also possible, indicating that your body is reacting strongly to the venom. You could notice blurred vision or find it difficult to breathe, which are signs that things are becoming more serious. In severe cases, symptoms can escalate to unconsciousness or paralysis. Recognizing these signs early is crucial because they can help us determine the severity of the bite and seek urgent medical care. Remember, understanding these symptoms is an important part of our overall approach to handling snake bites effectively. Let's go through the key steps to handle a snake bite effectively. First, it's important to keep the person calm. Anxiety can make the situation worse, so reassure them and keep them as relaxed as possible. Next, immobilize the limb that's affected. This helps slow the spread of venom through the body. Remember, do not cut the wound or try to suck out the venom. These actions can do more harm than good. Instead, focus on keeping the limb below the level of the heart. This reduces blood flow to the area, helping to slow the venom's spread. If there are any tight items like rings or tight clothing near the bite, remove them immediately. Swelling can occur quickly, and these items can become constrictive. Most importantly, get the person to a hospital immediately. Prompt medical attention is crucial. Once there, administering the polyvalent anti-snake venom serum, or ASV, is essential for neutralizing the venom. So to summarize, stay calm, immobilize the limb, avoid cutting or sucking the wound, keep the limb below heart level, remove tight items, rush to the hospital without delay, and ensure they receive the ASV. These steps can make a significant difference in managing a snake bite effectively. Let's talk about the fireman lift, a crucial technique in emergency situations. This method is designed to help us quickly and safely transport an unconscious or incapacitated person. The key here is to ensure we maintain the safety of both the victim and ourselves throughout the process. First, it's important to approach the victim carefully, making sure their head and neck are supported to prevent any further injury. We want to use a firm grip, usually around the person's waist or under their arms, to lift effectively. The fireman lift is especially useful because it allows us to carry someone over a distance without requiring a lot of space or complicated equipment. It's a practical skill that emphasizes quick, efficient movement, something that's essential in rescue scenarios. Remember, the overall theme of our training is about safety and preparedness. Mastering techniques like the fireman lift enhances our ability to respond confidently and effectively in emergencies. So, practice this lift regularly, always keeping safety at the forefront, because in real-life situations, these skills can make a real difference. Let's go through the key steps for performing the fireman lift. First, approach the person from behind, making sure you're in a safe position to assist. Next, gently lift the person across your shoulders, positioning them securely so they won't slip. It's important to secure their arms and legs to prevent any movement that could cause further injury or make the lift unstable. Throughout the process, keep your balance and move steadily to avoid dropping or hurting the person. Remember, use this technique only if a stretcher isn't available, as it's a quick way to move someone in emergency situations. Staying calm and methodical is essential to ensure safety for both of you. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about chlorine gas exposure. Chlorine gas is a common chemical that can pose serious health risks if inhaled or comes into contact with skin and eyes. When someone is exposed to chlorine gas, it can cause irritation of the respiratory system, leading to coughing, shortness of breath, and chest tightness. In more severe cases, it can damage the lungs and lead to pulmonary edema, which is dangerous. It's important to understand that chlorine gas is denser than air, so it tends to settle in low-lying areas, increasing the risk for those working at ground level. Recognizing the symptoms early and ensuring proper protective measures are in place can make a significant difference in safety. Connecting this to our overall theme, it highlights how critical it is to handle chemicals like chlorine responsibly and to have protocols in place for exposure emergencies. The very first step in responding to chlorine gas exposure is to move the person to fresh air immediately. It's crucial to take the victim away from the source of exposure and into open air where they can breathe more easily. Remember, your safety comes first, so make sure you're protected as well. Wear a mask and gloves to avoid inhaling or coming into contact with the toxic gas yourself. By acting quickly and carefully, we can help minimize the severity of the exposure and protect everyone involved. If breathing difficulty occurs, the first thing to do is keep the person calm and sitting upright. Staying calm can help prevent the situation from worsening. Sitting upright makes it easier for them to breathe. If you have access to oxygen, providing it can really make a difference in helping them get enough air. However, it's important to remember not to give mouth-to-mouth resuscitation unless you're properly trained. Knowing what to do in these moments can be critical, but safety and proper technique are key. These steps are vital because they help manage the immediate crisis while waiting for professional help to arrive. If eyes are affected, it's really important to act quickly and effectively. The first step is to rinse the eyes thoroughly with clean, running water. You want to do this for at least 15 to 20 minutes to help flush out any harmful substances. Remember, the longer you rinse, the better the chances of minimizing damage. If the person is wearing contact lenses, make sure to remove them as soon as possible. Removing the lenses allows the water to reach the eye directly and helps in cleaning the eye more thoroughly. This simple but crucial step can make a big difference in reducing potential injury and pain. Always keep in mind, quick and proper rinsing is key to managing eye exposure effectively. If your skin is exposed to the gas, the first and most important step is to wash the affected area thoroughly with running water. Make sure to do this for at least 20 minutes to really help remove as much of the gas as possible. It's crucial to avoid applying any creams, lotions, or oils on the skin at this point because they can trap the gas or worsen the irritation. Additionally, you should take off any clothing that has come into contact with the gas to prevent further skin exposure. Remember, quick and thorough washing, along with removing contaminated clothing, are key steps in minimizing injury and protecting your skin. This is a vital part of the overall safety response we're discussing today. If you or someone else starts coughing, vomiting, has difficulty breathing, or experiences chest pain, it's critical to seek medical help immediately. Don't delay. Rush to the nearest hospital as quickly as possible. When you arrive, be sure to inform the medical personnel that it's a case of chlorine gas exposure. This information is vital because it helps them understand the situation quickly and provide the appropriate treatment. Remember, quick action can make a big difference in managing the effects of chlorine gas and ensuring safety. So, always prioritize getting professional medical assistance right away in such cases. Hi abenos, hi hamenos, hi tegigenos, hi tabelenos, hi keanos, hi mukienos, hi biduenos, hi parenos, hi batenos, hi kateanos, hi haenos, hi yahenos, hi tabelenos, hi hamateanos, hi ligenos, hi bahutenos, hi mahetvaporenos, hi haenos, hi kyakianos, hi yahenos, hi nidtateanos, hi kateanos, hi haenos, hi kirenos, hi hameanos, hi kaseanos, hi ptatmektaenos, hi danienos, hi haenos, hi jubenos, hi hamenos, hi kaienos, hi vyaktionos, hi kaenos, hi samnaenos, hi karenos, hi daheanos, hi hogenos, hi subseanos, hi pahaleanos, hi lalenos, hi tungenos, hi kaenos, hi karenos, hi haenos, hi joinos, hi kivenos, hi immediatenos, hi stanianos, hi manos, hi ataenos, hi haenos, hi escaenos, hi mutalabenos, hi haenos, hi kivenos, hi ismaenos, hi jivanenos, hi koinos, hi kataenos, hi haenos, hi lakenenos, hi stitianos, hi alagenos, hi haenos, hi jesseanos, hi gumpidenos, hi ductastavenos, hi vaiuenos, hi madgenos, hi maenos, hi ducavatenos, hi yaenos, hi shokenos, hi inenos, hi gailoenos, hi koenos, hi subseanos, hi pahaleanos, hi alagenos, hi danaenos, hi chaheanos, hi audenos, hi tuduntenos, hi taspotenos, hi kutnaenos, hi chaheanos, hi dustaenos, hi pilaenos, hi yaenos, hi pileanos, hi tungenos, hi kaenos, hi kodenos, hi haenos, hi joinos, hi dilehalantenos, hi yanienos, hi kirenos, hi dadienos, hi seanos, hi nipetneanos, hi walaenos, hi haenos, hi esmaenos, hi gumpidenos, hi chacheanos, hi haenos, hi lakenenos, hi yaenos, hi tuduntenos, hi jivanenos, hi koenos, hi kataenos, hi nahienos, hi haenos, hi jesseanos, hi huddienos, hi trutnaenos, hi yaenos, hi benaenos, hi waiuenos, hi madgenos, hi maenos, hi samasiaenos, hi kaenos, hi jolneanos, hi inenos, hi gailoenos, hi kaenos, hi opchadenos, hi tortienos, hi dadienos, hi seanos, hi kiaenos, hi jaenos, hi saktaenos, hi haenos, hi tistaenos, hi hudaenos, hi yavenos, hi tungenos, hi kaenos, hi kodenos, hi haenos, hi jesseanos, hi minedenos, hi yaenos, hi cholneanos, hi waleanos, hi gaiolenos, hi kahaenos, hi jataenos, hi haenos, hi yaenos, hi veanos, hi logenos, hi haenos, hi joinos, hi mamulienos, hi chatoenos, hi jesseanos, hi kutenos, hi kadachenos, hi yaenos, hi chateanos, hi liveanos, hi cholenos, hi sakteanos, hi haenos, hi enhaenos, hi untamenos, hi maenos, hi yaenos, hi basicanos, hi perstenos, hi aedenos, hi maenos, hi paginos, hi saktaenos, hi haenos, hi untenos, hi maenos, hi kalaenos, hi yavenos, hi kaleanos, hi tungenos, hi kaenos, hi kodenos, hi haenos, hi joinos, hi dadenos, hi yaenos, hi exapectatenos, hi kaenos, hi ptatinidhitbenos, hi kataenos, hi haenos, hi ismaenos, hi veanos, hi gaiolenos, hi hoteanos, hi haenos, hi jinmeanos, hi sasenos, hi nahienos, hindi hi aenos, hi dahienos, hi haenos, hi yaenos, hi pidenos, hi chacheanos, hi haenos, hi kirenos, hi jivanenos, hi sambhavenos, hi nahienos, hi haenos, hi inenos, hi pudenos resuscitation, hi nahienos, hi kutnienos, hi chahienos, hi kasakadenos, hi jubenos, hi humenos, hi barkhaenos, hi pemaneanos, hi pudenos, hi vyaktionos, hi kaenos, hi samnaenos, hi kudenos, hi dahenos, hi hovenos, He yahenos, he table anos, he hume anos, he yahenos, he samajne anos, he me anos, he mudded anos, he kutta anos, he haenos, he kiranos, he kissed anos, he koanos, he pahale anos, he dake pal anos, he kutni anos, he heranos. He kiseanos, he bad anos, he meanos, he odanos, he kiseanos, he nahienos, he yahenos, he ptatmictaenos, he tienos, he kaneanos, he kaenos, he akenos, he bohutanos, he hianos, he jaturianos, he upakataranos, he haenos, he takianos, he humanos, he adikatamanos, he jivananos, he bachananos, he meanos, he sakshamanos, he hoinos, he sakeanos. Let's go through some essential first aid medicines and their purposes. Paracetamol, known by brands like Dolo 650 or Saridin, is primarily used for reducing fever and relieving mild to moderate pain, such as headaches or body aches. Ibuprofen, available as Brufen or Combiflam, is effective for pain, swelling, and inflammation, especially when there's an injury or joint issue. Antihistamines like cetirizine and loratadine are your go-to for allergies, helping with itching, skin rashes, or mild insect bites. For acidity or heartburn, antacid tablets such as Digene or Gelusol can provide quick relief. In case of cuts or wounds, antiseptic solutions like Savlon or Dettol are essential for cleaning to prevent infection. For minor cuts, abrasions, or even small burns, antiseptic ointments such as betadine or cyplidine are recommended to promote healing and reduce infection risk. If you have minor burns or scalds, burn ointments like Burn Heal can be very helpful. Coughing. Cough syrups containing Ambroxol or dextromethorphan can ease your cough and help you breathe easier. For eye irritation caused by dust or minor infections, eye drops like Alsiflox D are effective. Muscle pain or sprains. A pain relief spray or balm, such as Omni Gel or Iodex, can provide local relief. Feeling nauseous or experiencing vomiting, Avamine antihistamine can help reduce those symptoms. And for diarrhea or loose motions, difenoxylate, like Lamofen Plus, is used to control bowel movements. In summary, having this list of first aid medicines ready can be crucial in managing minor health issues effectively and swiftly, connecting to our overall goal of being prepared and responsive in emergency situations. Thank you so much for your time and attention today. I really appreciate the opportunity to share these insights with you. Remember, the key points we've discussed, whether it's the importance of innovation, collaboration, or continuous improvement, are all vital to achieving success in our field. I hope this presentation has inspired you to think differently and to apply these concepts in your own work. Again, thank you for being such an engaged audience. I look forward to seeing how you implement these ideas moving forward.